Hello, this is Dr. Dye, and welcome to my website, NatMedCME.com. I've created this website to highlight opportunities for continuing education designed for holistic practitioners, naturopathic doctors, medical students, psychologists, and anyone really that's interested in alternative medicine. In particular, I am offering weekend workshops in mind-body healing. I happen to be department chair of mind-body medicine at Southwest College of Naturopathic Medicine. And I graduated in 1979 from National College of Naturopathic Medicine in Portland. But really my interest in mind-body healing goes further back to my undergraduate years at Whittier College, and my major back then was psychobiology, and I had an interest in the brain and in neurology and the neuropsychology, and I designed a curriculum that at the time I had little idea that how I would be using it in naturopathic medicine, but I did incorporate the science of biofeedback. I created a biofeedback lab at Whittier College, and I made a pretty in-depth study of the biochemistry of behavior. And then when I went to National College, I had intended to infuse my naturopathic education and practice with mind-body principles, which I did do, although it took a twist that I hadn't foreseen, and for the first at least 14, 15 years of my practice, I specialized in home birth and in obstetrics. And I even became department chair at National College in obstetrics. I taught the OB/GYN courses, and I developed my own style of doing birthing with mind-body healing principles, so that the patients who would come in for their prenatal care would receive an in-depth we called it the family interview. It was really a birth counselor interview of the husband and the wife and often the family members, where we would probe and listen and develop an understanding of the kinds of stresses and psychological and other factors that could have influenced birthing. And by working in teams and developing therapeutic birth classes and using principles and therapies that incorporated mind-body, like birth hypnosis, and the interviews that we would use with couples would often identify particular core issues within the family that needed to be addressed. And I firmly believe that that work made a huge difference in the outcomes in my practice. And as a collective group of us that worked this way, in hundreds of births that we did, we got our C-section rate down to less than 1%. We had many beautiful breakthroughs using mind-body healing. And when I sold my practice and moved to Arizona in the early 90s, I knew that I would want to incorporate a lot of what I learned in those days into my practice. And I practiced at first in Sedona, and I quickly decided to sign on to teach at Southwest College. And in my role there as department chair of Mind Body, I developed a whole curriculum of the coursework that includes courses in stress management, fundamentals of mind-body medicine, practicum in mind-body healing, which is going to be one of the weekend courses that I offer. I developed courses in biofeedback and neurofeedback and in medical hypnosis. And all told, some of the courses are required and some of the courses are electives. We offered a course in naturopathic treatments for mental illness. So there's a very well-rounded curriculum that students at Southwest have an opportunity to expose themselves to in their training. But I quickly realized, traveling around the country, that a lot of the work that we do is not available in the other colleges or in other parts of the country. So I've developed these workshops to give practitioners and medical students a chance to immerse themselves in protocols, treatment plans, techniques, and just a way of approaching patient care that is very practical and very applicable to a routine medical practice. The workshops will offer not only direct experiential training with lots of breakaways and opportunities for people to learn the various skills, but they'll also come away with very detailed notes with step-by-step protocols in the various techniques that we teach. The workshops typically go on weekends, and I'll take courses that may have taken place over 10 or 11 weeks at the college, and we organize them and reorganize them so that they could be taught in a weekend, on a Friday night, Saturday, Sunday. I will offer the detailed description of each event in a separate video, but I'm hoping that you will find the trainings very meaningful and look over the website at NatMedCME.com, and we'll see if there are workshops that you'd be interested in. I would really look forward to meeting you there. Thanks.